Welcome to Module 1. This module will introduce you to the course. In this lecture, we will present you an overview of what you would learn in Module 1. Other than this overview, you would find 3 numbers of detailed presentations which have been uploaded separately. Also, within those PPTs, you would find links to many documents for reference. So, what are the contents covered? They are urban life opportunities and challenges, vulnerability and intersectionality, types of barriers, role of stakeholders to remove barriers, objectives of inclusive city, global vision on inclusion, aspects of inclusion, global guidelines and strategies on inclusion, global examples of sector-specific solutions, and takeaways from good practices. Now, modern cities are supposed to be convenient and enjoyable places for living and working to most of the users. It should be full of diverse opportunities like health, housing, facilities, education, recreation, and employment. But in reality, there exist latent uncertainties, hidden anxieties, and potential dangers for the vulnerable or the marginalized groups of people, and many of our cities are in fact not inclusive. So, what is inclusiveness? Urban inclusiveness, according to Henry Lefebvre, can be achieved through participation, appropriation, and creation of value in the context of urban life of its marginalized subjects. Inclusivity, access, and safety are dynamically produced through appropriate interaction with urban spaces, which help people to cherish their values. So those who are left behind are persons with disabilities, and that include locomotor disability. Now, this is a physical disability in which a person is unable to execute distinctive activities associated with movement of self and objects, resulting from affliction of musculoskeletal or nervous system, or both. We also have visual impairment. This is a physical disability which includes persons who are blind and also persons with low vision. Hearing impairment is a physical disability which includes persons who are deaf and persons who are hard of hearing. Intellectual disability is a condition characterized by significant limitations both in intellectual functioning, which is reasoning, learning, problem solving, and in adaptive behavior, which covers a range of everyday social and practical skills, including specific learning disabilities and autism spectrum disorder. Other than these, we also have the elderly, the children, and the women.
To understand the magnitude of this problem, let's look into some statistics. This slide shows that 15% of the world population are disabled, of whom 80% live in developing countries. In India, out of 26.8 million of population who are disabled, about 18 million live in rural areas. Now, the serious concern is about 61% of the person with disabilities aged between 5 and 19 when attending an educational institution only. Also, women with disabilities are at a much more disadvantageous position as compared to men with disabilities. So, the intersectionality of age, disability and gender is very eminent. Now, let's try to understand what are the common barriers to inclusion, or rather, what causes exclusion or segregation. Now, a person who is blind or wheelchair bound, unable to move independently in the urban environment, unable to walk up these overbridges and flyovers, that these are some common pictures which come to our mind when we talk about a person with disability. But it's much more. For example, an elderly person who is not able to board a train because of the crowding, that's also a barrier. An uneven footpath with disconnected tactile guidelines is a very severe barrier. Think about this situation where all these bollards are put with a good intention of segregating the vehicular traffic and the pedestrian traffic, but in the process, people who are moving on wheelchair, they also cannot enter this pedestrian zone because of the improper spacing of the bollards. So even this is a barrier. There are other barriers also. Can you read this? Probably you cannot. But you can now read it. So for elderly or person with cataract or people with blurred vision, every text which appears to others like this, as clear as this, appear to them as this. People who are not familiar with a particular language, they cannot understand the signage, and for them wayfinding is a challenge. There are other barriers as well. Think of a child who is not able to play with her friends due to the absence of accessible play furniture. An educated adult who cannot be employed due to the lack of accessible workplace and sensitive HR policies for recruitment. When services are denied to people. So everything is a barrier. So we have to understand all these, which make people fall into a loop of deprivation. Some of the barriers which exist in urban places or systems and services can be easily seen, and some cannot be. Broadly, the barriers can be divided into 4 categories. There are physical barriers, which are structural, easily visible, and tangible, seen in the outdoor environment and transportation system. Some examples are unsafe street crossing, inaccessible foot overbridge and subways, inaccessible toilets, absence of tactile guidance, lack of seating and public facilities. There are psychological barriers like fear of anticipated pain and discomfort in an outdoor environment, fear of being stampeded in a crowded situation, anxiety in an unknown place, social barriers of being dependent, being a burden, being stigmatized, and institutional barriers like discriminatory laws which denies access to urban places and services. The implications of these barriers are far-reaching. It is just not denying physical access to a place or service, but it creates inequality, denies autonomy, and also violates dignity. So all these components together, like belonging to a disadvantageous community, lack of a supportive environment, social rejection, unwanted sympathy, lack of physical and sensory competence, of course, lead to the development of low self-esteem, which finally leads to withdrawal and disempowerment. So what can we do? How do we break the circle? By providing a supportive environment and through awareness generation, where lies our role. So in a nutshell, the responsibility of the urban planners and policymakers is to provide an accessible environment through evidence-based decision making and participatory planning. The goal is therefore to create an enabling environment through urban policies that promote justice, sustainability, and inclusion in cities.
So, by now you must have realized that the solution is an inclusive city for breaking the cycle. Inclusive city will have accessibility as a fundamental feature of urban environment, which allows people to reach and subsequently use diverse facilities and opportunities, allowing dignified participation in social and economic activities. So, if we look into the objectives and vision of inclusive cities, we have avoiding discrimination and segregation due to the presence of sensory, attitudinal, cognitive, physical, and economic barriers. Also, ensuring that everyone, including people with disabilities, the elderly and children, women and parents with children, can participate in society, access built environment, transport, services, and urban amenities, including recreation and also livelihood and information. The vision therefore includes these 7 points. 1. Safety. Number 2. Sense of security. 3. Psychological comfort. 4. Economic independence. 5. Decent quality of life. 6. A feeling of self-worth. And 7. Social acceptance.
This module will give you an in-depth understanding of the global vision on inclusivity. It will take you through the timeline of major inclusive policies, some of which are related to aging, some are concerned about PWD, some about children, and some, like the Sustainable Development Goals, are for all. This module has included the Sustainable Development Goals and in the detailed PPTs. If you click on each of these Sustainable Development Goals, you would get to know the specific aspects of inclusion for that goal. The 8 guiding principles of UNDIS, that is United Nations Disability Inclusion Strategy, like respect, non-discrimination, participation, acceptance, opportunity, accessibility, have been elaborated. Next. This module will tell you about some of the really good practices from across the globe. There are some multi-sectoral approaches, that is pan-city initiatives, and some sector-specific examples. In the PPTs which are uploaded, details are given on the sector-specific examples. Just to mention a few, like the wayfinding project in New York, color-coded accessibility map, the Braille network, accessible schools and recreation. Also, good example of participatory planning in city development projects are given. For the multi-sectoral examples, what has been done in USA, Europe and Singapore, that have been included. Please note that there is a fair amount of similarity in coverage in these multi-sectoral approaches like outdoor environment, transportation, livelihood, participation, recreation, etc. So after you have gone through this, you would see that these are some of the strategies compiled from the good practices. These include to meaningfully engage the vulnerable groups at all stages of planning and monitoring, to track inclusion and empowerment of persons with disability, elderly, women and children in national response and recovery plans, to improve health outcomes for persons from vulnerable groups, to build sustainable and inclusive social protection system for all, to address the specific situation of workers with disabilities, women and elderly in all sectors, to invest in community-based solutions, to initiate multi-sectoral dialogue and collaboration. So these are actually what we learned from the good practices which have been discussed. And this module finally will conclude by stressing upon 2 major aspects of inclusion, that is physical and spatial inclusion and digital inclusion. There are some other important aspects which you also need to be aware, and of this course will help you in this, in being aware of the codal provisions, national and international standards and guidelines, sector related actionable agenda, awards and recognitions to incentivize private organizations, mode of participation and engagement, budgeting, monitoring, and awareness generation methods. So, studying about all this, you might be curious to know what's the status on inclusivity in our country. What have we been doing? Are we lagging behind? The answer is definitely not. So the next module, which is termed as India and Inclusion, will make you aware of the existing status of inclusivity in India by elaborating on existing acts, schemes, guidelines and codes. Examples of sector-wise good practices are included in the next module. So, happy learning.